Have you ever wondered why some people lose a significant amount of weight when they're on a GLP-1 like Wegovy or Zepbound, and other people don't seem to lose very much weight on that very same medication? The answer may be that they have different obesity phenotypes, and there are 4 phenotypes. Today I'm going to talk about one, and in the next 3 videos I'm going to go over the other 3. My name is Dr. Lindsay Ogle, and I'm a board-certified family medicine and obesity medicine physician, and I treat patients all throughout the state of Missouri through my telehealth clinic, Missouri Metabolic Health. If you take away anything from today, it's that if somebody is trying to sell you a one-size-fits-all approach, whether that's a physician or a dietitian or a nutritionist or a coach or a trainer, they're probably just trying to make money off of you, because there is not a one-size-fits-all approach. Even in the modern era where we have our powerful tools like GLP-1 agonists, there are a subset of people who that's not the right treatment for them. And we see that in studies. There are people who lose up to 50% of their body weight while on a GLP-1. And there are other people who actually gain weight while on a GLP-1. And one of the major reasons for that is obesity phenotypes. Today we're going to talk about obesity phenotype number 1, and that is hungry brain. Hungry brain obesity phenotype occurs when somebody has excessive amounts of hunger throughout the day. So somebody who has hungry brain is going to experience, completing a meal. So they'll have, let's say, breakfast, and they'll have a substantial breakfast, something that has the amount of calories and nutrition that would be enough to sustain them, but they're not satisfied after that meal. They continue to have hunger. Their brain is telling them that they need more, even though nutritionally they have what their body needs. Their brain isn't registering that, and it's sending that hunger signal, or it's receiving that hunger signal, and the person is experiencing excessive hunger after the meal. Makes it very hard to stick to smaller portions and to stick to 3 meals throughout the day. Somebody who has a hungry brain obesity phenotype has treatment options available. The medications that are tailored to them would be either phentermine or Qsymia. The reason these medications are so powerful for the hungry brain phenotype is that they work at the brain level and they help to block hunger signals to the brain. So somebody who is able to take phentermine or Qsymia and they have hungry brain, they are going to notice that they are no longer having that excessive hunger. They're no longer having to fight constant hunger throughout the day. They're able to stick to their nutrition plan, eat those 3 healthy meals throughout the day, and move on with their life. They're not having to constantly resist or give in to their excessive hunger because the phentermine or Qsymia is controlling their hunger. It's important to know that phentermine is a stimulant, and therefore it's a controlled medication. And so to be prescribed this, you need to be seen by an in-person physician who can evaluate you and check your vital signs to make sure it is safe to take this medication. Of note, phentermine is FDA approved for short-term use only for 3 months. But anybody who's been trained in the obesity medicine field knows that obesity is a chronic medical condition and requires chronic treatment. It is recommended by obesity physicians to take phentermine long-term. There are a few states that don't allow this, and you may have to take a break off of phentermine. But we know that you'll have best results if you take it long-term to continue to treat the underlying obesity phenotype of hungry brain and control that excess hunger. Studies have proven that it is safe to take long-term. We use stimulants long-term to control other chronic medical conditions, most commonly ADHD, and we see healthy, fine outcomes. Reasons that we would not want to take phentermine would be if you are pregnant or breastfeeding, if you have uncontrolled high blood pressure or uncontrolled high thyroid levels, hyperthyroidism, or if you've had recent cardiac conditions, like a recent heart attack or heart failure, or an arrhythmia like AFib. Stimulants may also trigger anxiety symptoms and may interfere with sleep. And so not everybody is going to tolerate phentermine, but it is a great option for somebody with hungry brain. The medication Qsymia is a combination medication. This is phentermine plus topiramate. So it is also considered controlled and should be prescribed by an in-person physician. Qsymia is FDA approved for long-term use, and so in any state you can use it long-term. It has the same risk-benefit profile as phentermine, but with the addition of topiramate, it's really important to know that you cannot become pregnant while on topiramate or on Qsymia, because topiramate is known to negatively impact the pregnancy. And so you have to be on an effective birth control to be prescribed Qsymia. It also can increase the risk of kidney stones in somebody who is at risk for kidney stones. So if you've had a history of kidney stones, maybe Qsymia is not the medicine for you. Both of these medications are oral medications, and they are quite less expensive than the GLP-1 medications. Phentermine is often about $10 to $20 for a month prescription, and Qsymia can be $100 or less depending on how it's prescribed. But you can get brand name, even delivered to your house for $100 or less, or your doctor can prescribe the medications independently, so the phentermine plus the topiramate, and you can take them together, and oftentimes that can be done for $40 or less per month. For individuals with hungry brain, the optimal bariatric and metabolic surgery is sleeve gastrectomy or the gastric sleeve. And the reason this can be very helpful is that the gastric sleeve turns our stomach into a smaller pouch. And so the stomach has stretch receptors on it. And when we eat and our stomach is stretched, that triggers a signal to the brain that we've had enough food and that we should stop eating. And so when someone has the sleeve gastrectomy, then they're more likely to have those hunger signals sent to the brain. Also, one of the main hunger hormones in our body, it's called ghrelin, and it is released in the portion of the stomach that is removed during a sleeve gastrectomy. And so with a sleeve gastrectomy, patients are going to have a lower threshold to where their stretch receptors in their stomach are turned on and signal the brain that we've had enough food to eat. And the cells that release ghrelin, our main hunger hormone, that part of the stomach is going to be removed. And so there is less of that hormone signaling in the brain to tell it that it is hungry or that we need more food. That is why sleeve gastrectomy or gastric sleeve or the sleeve is the ultimate or the optimal surgery for somebody who has hungry brain, because it's going to treat the underlying pathology and manage that obesity phenotype. From a lifestyle perspective, people who have hungry brain benefit from a high volume meal. You can also think of it as a high fiber diet. Foods that are going to be great for hungry brain are fruits, vegetables, and whole grains. We're thinking about things that take up a lot of space that don't have as many calories in it. And so when we're able to eat more food with less calories and more nutrients in it, then it's going to turn on those stretch receptors in the stomach that we talked about that are going to tell the brain that we've had enough food and we don't need to be hungry anymore. In recap, there are 4 obesity phenotypes. The first one we talked about today is hungry brain. And the best treatment options for hungry brain from a medication standpoint is phentermine or Qsymia. From a surgical standpoint, it's sleeve gastrectomy. And from a lifestyle standpoint, it is voluminous eating or a high fiber diet. Subscribe so you will get the next 3 videos released over the next 3 weeks about the other 3 obesity phenotypes. Take this information and apply it to yourself. Bring it to your treatment team, your obesity medicine physician, your bariatric surgeon, or your dietitian so you can create a tailored treatment plan that is best for you to allow you to have the most optimal results. Can't wait to see you next week. Take care.